This is a 43-year-old white female. I'm going to be doing a physical assessment on her, which consists of her respiratory and cardiac systems. First of all, I'm going to start off with inspecting, which is looking to see if there's any abnormalities that I can see with my eyes. There's no signs of distress noted. There's no signs of the patient that is in pain. Also, if you will look at her lips, there's no signs of stenosis noted. So next, I'm going to see if her thorax and her trachea is midline. Then I'm going to palpate it to see. Okay, there's no signs of the trachea not being midline. Also, the thorax is midline. When I place my hand here, tell me if there's any pain or tenderness noted.
No.
Okay. No pain, no tenderness noted.
No.
Posterior or anterior or laterally. Next, I'm going to be doing the tactile firmness, which is when I place my hand on your chest, then I want you to say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, the tactile firmness, which tests for if the vibration is normal throughout, and it is normal, and if it is a dull vibration, then that could be meaning pneumonia or a pneumothorax. A pneumothorax is when your chest cavity is collapsed. Also, I'm going to be doing the percuss, which is I'm going to place my fingers right here and then tap on my fingers to see if the resonance is heard throughout. The resonance is heard throughout. It wasn't able to be heard as much on the anterior due to the breast tissue. Next, I'm going to be feeling to see if your expansion is symmetric. When I place my hands right here, I need you to inhale and then exhale. Okay, that's normal on that side. Turn around. Okay. Inhale, exhale. Okay, the expansion of her chest is symmetric, which is a normal response. Next, I'm going to be auscultating or listening to your lung sounds to make sure there's no abnormalities noted. Okay, when I place my stethoscope on your chest, inhale and exhale. Okay, there's no adventitious breath sounds noted, which means no wheezing, no bronchi, no rails noted. The inspiration is greater than the expiration, which is a normal response. Breath sounds are even and unlabored. Alright, that completes the respiratory part of the exam. Now I'm going to move on to the cardiac. First, I'm going to start by inspecting your carotid arteries to see if they're bounding or protruding from your skin. Bounding might often need a referral to a cardiologist because it could mean abnormal abnormal pulse rhythm, which might need attention from a specialist. So let me listen to your heart, and then I'm going to palpate it. First, I'm going to do the aortic area, then the pulmonic area, then the mid-precardial aorta, and then the tricuspid area is located right underneath the breast area, and then to my right is the mitral area. Okay, S1 and S2 was heard. No adventitious heart sounds, no murmurs, no rubs, no clicks. Your heart rhythm was normal, which is 80 beats per minute. Next, I'm going to check your capillary refill, which is less than 2 or less than 3. Okay, less than 3, which is a normal response. I'm going to do your toes. Okay, less than 3. Bilaterally. Next, I'm going to palpate your pulses. Can I get you to lie on your back for me? Okay. First, I'm going to start off with her carotid artery to feel if it's equal and bilaterally and less than 2, which is a normal response. Okay, next I'm going to move on to her brachial. Equal, bilaterally, less than 2. Okay, her radial, which is felt right here in the wrist. Equal, bilaterally, less than 2. Okay, next I'm going to feel her femoral. Equal, bilaterally, less than 2. Okay. Her posterior tibial. Equal, bilateral, less than 2, okay. Now her dorsalis pedialis, her pedal pulse is equal, less than 2. Okay, that completes your cardiac assessment. I didn't hear any abnormalities, which consist of a murmur or clicks or rubs. Your pulses were equal and bilaterally. Okay, now I'm going to go over the different things that I would chart if I was charting this physical assessment. First, I want to state how old she is. Then I want to state if she is alert and oriented times 3. Then the way you see if a patient is cyanotic is you examine their lips. That's usually the first sign. A lot of COPD patients will be cyanotic around the lips, which would be a blue periwinkle color. No signs and symptoms of distress. You also want to always remember to state what you're assessing. Like I was assessing the cardiac and the respiratory system. Then you want to note that if the trachea and thorax is a midline, no pain or tenderness noted. On the tactile fremitus, you want to state that it was a normal response. Vibration was strong and not dull. Then you want to state when you percuss that it was resonance is heard throughout. State that it was a little duller in the anterior part due to breast tissue, but it was overall an abnormal response. When you auscultate the lungs, you want to note that the breath sounds is even and unlabored. The inspiration is greater than expiration. No adventitious breath sounds. No wheezing, no ronchi, no rails. When you that completes the respiratory part, but when you do the heart physical assessment, when you go to chart it, you want to note that there's no bounding, no weak pulses, it's normal. The carotid artery is equal and bilaterally. When you chart the different pulses, you want to make sure you list every pulse and note if they're equal and bilateral pulses. You also want to note their heartbeat. Hers was 80 beats per minute. You want to note that S1 and S2 was heard. There was no adventitious heart sounds such as murmurs, clicks, or rubs. And then you want to note that the point of the maximus is right here, and it is a normal response for it to be non-palpable. You want to make sure and note that. Then also you want to note that her, actually, when she breathes in and out, her symmetric expansion was even and bilaterally, posterior and anterior. Make sure and note that in your respiratory assessment. And that completes her physical assessment with her heart and respiratory system. And thank you.